Good afternoon. I am Dr. Lisa Isaac, President of Gateway Medical Society, and it is my pleasure to welcome you to our 2022 Community Symposium Series. Greetings and welcome to all, newcomers and repeat participants alike. We are so pleased that you have decided to join us this afternoon. Last year, presenting our virtual symposium in installments was very well received, and so we are excited to continue that format this year. This is our first installment, and it promises to be quite informative. Gateway Medical Society, established in Pittsburgh in 1963, is a component of the National Medical Association. Our mission is to eradicate healthcare disparities. We conduct our mission in several ways, including, but not limited to, providing education to promote public health, raising awareness of the healthcare disparities in minority and disadvantaged communities, and collaborating with other groups who have similar missions. I am pleased to announce that this afternoon, we have the distinct pleasure of collaborating with the Pittsburgh Black Nurses in Action. This group has always been supportive of Gateway Medical Society activities, and we are happy to share this program with them. The topic today is heart disease and healthy lifestyle choices, a subject that is very important for communities of color. Today, we have two exciting panelists and a dynamic moderator, Lisa A. Holt. Lisa Holt is a director of operations for the UPMC Heart and Vascular Institute. Lisa has an undergraduate degree in finance and economics from Temple University, a second degree in nursing from Duquesne University, and a master's in business administration from Robert Morris University. She has a certification in diversity, equity, and inclusion from Cornell University and is actively engaged in community health outreach efforts. Lisa served in the United States Army Reserve and is the board chair for A Second Chance Incorporated, a nonprofit kinship organization, and has done that for the past 10 years. In her spare time, Lisa teaches Zumba at a local community center. Before I turn it over to this capable moderator, I must take a moment to thank our symposium partners, including the Heinz Endowments, UPMC, Highmark Whole Care, Pittsburgh Black Nurses in Action, Chi Eta Phi Nursing Sorority, the Faith-Based Health Collaborative, the Links Incorporated, and my sisters at Alpha Kappa Alpha Sorority Incorporated, Alpha Alpha Omega Chapter, and anyone that has helped or will help with any part of this symposium series. Thanks to all for making it possible. And now I turn this program over to the capable hands of our moderator, Lisa Holt, who will introduce our panelists. Thank you, and take it away, Lisa.
Dr. Isaac, thank you so much for the wonderful introduction and for inviting us to your event. Before we get started, I wanted to give everyone a few housekeeping updates. One, this webinar is muted and there will be a Q&A session after both presentations are completed. Questions can be submitted in the chat box anytime during or after the presentations. And finally, this webinar will be recorded and will be available for future viewing on the Gateway Medical Society website. In the African American community, heart disease is widely prevalent, often untreated, and is a leading cause of death. Today, our speakers, Dr. Amber Johnson and Ruth Wilson, will address these issues as they relate to community health, COVID, cardiovascular disease, and healthy life choices. Dr. Amber Johnson is an associate professor of medicine at the University of Pittsburgh. She is a staff cardiologist at UPMC and the Veterans Administration Pittsburgh Health Center System. She is also a faculty affiliate at the Center for Race and Social Programs at the University of Pittsburgh School of Social Work. Dr. Johnson completed her undergraduate degree with honors at the University of Pittsburgh. She completed her medical degree and Master of Business Administration at Jefferson Medical College, Widener University. In addition to a year of patient safety and quality improvement training at the Armstrong Institute of Johns Hopkins Hospital, she was an internal medicine resident at the Johns Hopkins Bayview campus. Dr. Johnson completed her general cardiology and research fellowships and obtained another master's degree in clinical research from the University of Pittsburgh. Dr. Johnson's research in the interface of health equity, social determinants of health, and mobile health technology has resulted in numerous publications and federal grant funding. She is the recipient of local and national clinical and research awards and was recently named to one of the National Minority Quality Forum's 40 Under 40 Leaders in Health. Dr. Johnson serves on the Black Equity Coalition Health Equity Working Group and has been committed to addressing racial inequity in cardiovascular care. She enjoys cooking, running, and spending time with family. Dr. Johnson is the mother of 2 daughters, Leilani and Nia. Ruth Wilson. Ruth Wilson is a registered nurse who has worked at UPMC for 19 years. Her area of nursing specialty is oncology medicine. Ruth is an active member of the National Black Nurses Association, also known as NBNA. She is also a member of the local chapter, Pittsburgh Black Nurses in Action, PBNIA, where she serves as the recording secretary and committee member for health policy and community outreach efforts. Ruth is a passionate community health advocate. In addition to being a certified YMCA fitness instructor, she has led church health ministries and facilitated healthy community initiatives for more than 17 years. Ruth is an Allegheny County resident who shares 3 children with her husband of 18 years. Please welcome Dr. Amber Johnson as she presents her topic, followed by Ruth Johnson. Dr. Johnson, please take it away.
Thank you so much, Lisa. I am going to share my slides, I think. It says the host has disabled sharing. Okay, it looks like maybe Dr. Edwards. Okay, all right. Thank you, Dr. Edwards, for pulling up my slides. All right, so I'll go ahead and get into it. I'm Amber Johnson. Thank you so much, Lisa, for that wonderful introduction. One thing that I will correct, I guess, is that I'm not quite an associate professor yet, getting there, hopefully within the next few years, but I am currently an assistant professor of medicine and clinical and translational science at Pitt. So next slide, please. As Lisa indicated, I work at UPMC as well as the VA, and I do the majority of my time is spent doing clinical research. And one of my guiding principles is that health equity research requires attention to issues of social justice. Next slide, please. The goals of this presentation are to briefly review some definitions, to explain the background for neighborhood level social determinants of health, and that's mostly what I study. I look at social determinants, particularly how neighborhoods can influence outcomes for health. I also want to describe the problem from a clinician scientist perspective, and I'll give some clinical examples. And then we can explore some next steps. Next slide, please. So what is health equity? It's an ongoing process to assure the conditions necessary to achieve optimal health for all people. To achieve health equity, we first need to value all individuals and populations equally. We need to recognize and rectify historical injustices that have led to disproportionate harm on marginalized communities and provide resources according to population needs. Social determinants of health are the conditions and the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning, quality of life, outcomes, and risks. One index that I like to use is called the Area Deprivation Index, but there are a number of other indices that capture some of these similar concepts, which they have different pros and cons, but The Area Deprivation Index in particular is a measure that incorporates relevant socioeconomic variables to provide standardized neighborhood rankings by status, thus enabling the evaluation of outcomes of geographic location based on level of disadvantage. And one of the clinical examples that I'll give is about atrial fibrillation. I'm a cardiologist, and so I study different cardiovascular diseases. One of the lesser known diseases is called atrial fibrillation. It's actually relatively common. It's the most common heart arrhythmia, but I would say that it's underdiagnosed, particularly in the Black community. It's an irregular, often rapid heart rate that commonly causes poor blood flow. And it has to do with the top chambers of the heart, the atria, which be out of coordination with the other chambers of the heart. It can lead to symptoms like palpitations, shortness of breath, and fatigue. And treatments include different drugs or therapies or procedures to treat it. Next slide, please. Next slide, please.
I'm sorry, we are trying.
It's probably going to skip all the way
There
to
we
the end
go.
now if you keep clicking it. Yeah, it's like, I don't know what it is about PowerPoint sometimes. So this is a conceptualization of social determinants of health. This comes from healthypeople.gov for 2020. They did an updated one for 2030 where these same categories are in place. And so when you think about social determinants of health, they capture them in these 5 buckets, which include access to health and healthcare quality, social context, interactions with people that determine your social context and then your outcomes of health, the built environment and neighborhoods in which you live, your education, that includes education from grade school all the way through adolescence for children, but also the extent to which you understand the information that you get from your physician, from your doctor, your health literacy. And lastly, economic stability and the ability to afford equitable health care. Next slide. Some technical difficulties. So it's important to recognize that health inequities abound. They're all around us. And as I illustrated on the previous slide, you could see those different areas in which social determinants of health can be captured throughout all of the things that you interact with throughout a daily basis and that affect your life. Next slide, please. I want to spend a moment to talk about health inequities and social determinants as it relates to COVID-19. I think we've all become increasingly aware of social determinants in the context of our current pandemic. We see that in the lay press, for example, like this comes from vicenews.com, that people are beginning to realize that the outcomes that we have may depend on how much money you have and where you live. And the pandemic has shown us in the starkest terms that inequality kills. Addressing social determinants could make a meaningful difference to health if we consider that poverty, racism, housing aren't just correlated with poor outcomes, but can actually cause them. Next slide, please. We've all, I'm sure, heard of the term redlining. This is a map from, I don't even remember when it's from. I want to say like the 1920s or so of Pittsburgh. And you can see the 3 rivers, you can see the neighborhoods that we're all familiar with. And those that are highlighted in red had been determined by our banking systems to be less desirable for funding people to be able to afford housing. So how does that relate to health outcomes? Well, it's really interesting that when we do this map, for redlining, we can see it, historically, this is what it looked like, but those red lines overlap with a lot of the healthcare outcomes that we see as well. We could do the same map for hypertension outcomes. We could do this map for access to care. We could do this map for so many different things. Ruth Wilson's going to talk about her experience, and she's an oncology nurse. I bet if we did this for cancer outcomes, we might see some of the same things, that those areas outlined in red have the worst outcomes. Next slide, please. So let's talk about neighborhood context and how it determines outcomes. You'll have to click through it. So the neighborhoods in which we live, please continue to click, include distributions of race, ethnicity, income, education, crime, and proximity to healthcare. And those things can then influence our ability to maintain wellness and to be healthy. Next slide. This is an example of some of the work that I've done, and we use the area deprivation index, which is the picture on the left side of the slide, and you can see how the index overlaps with the state of Pennsylvania. And kind of what I was alluding to before with the redlining, you can see that the red colors represent the most socioeconomically deprived areas. I think that that probably does stem from some historical barriers such as redlining. If we were to drill down in Pittsburgh, which looks mostly blue here, we would see those pockets of socioeconomic disadvantage there as well. And what we were able to do using UPMC data on the main portion of the slide, you see that if we look at the quintiles, the groupings of area deprivation index, we find that those with the most disadvantage, the neighborhoods with the most disadvantage, were 25% more likely to die from a cardiovascular reason based on our sample that we used. Next slide, please. So I've been thinking a lot within the space of healthcare, the healthcare that we can provide, what providers can do in the clinical context, physicians, nurses, others in the clinical context, but also thinking more broadly about other solutions to build a more capable workforce. And a lot of the things that we can do include training or bias reduction of the doctors who care for patients in the healthcare setting, but also recruiting and retaining a diverse faculty and staff is another way that we can build up people who are mindful of disparities in outcome, mindful of how neighborhoods and social determinants affect health outcomes, so that the care that we provide within our healthcare settings is more equitable as well. And this is a figure that we came up with from a paper that we published. I think that reference number 5 is inaccurate. I think it should be 2020, looking at the diverse and equitable future. Next slide, please. So in summary, I just wanted to mention about medicine's diversification. I wanted to mention that in the context of our health equity crisis, in the context of social determinants of health, that the social determinants that our patients bring can be met with a diverse workforce so that we can understand from a human perspective how patients can interact more equitably within our healthcare systems. Next slide, please. So moving forward, I think that patient-centered health equity approaches will include understanding how social and structural factors, including race, neighborhood, resources, economic status, educational attainment, are all associated with clinical outcomes. I know that I'm speaking to a group of physicians and nurses and people who are in the healthcare system. And so I think that we can all be mindful of these things. I think to do so will require intentional funding policies as well from those who fund clinical research and those who fund different initiatives in the community. And sustained reinforced initiatives are needed from our funders, researchers, and academic institutions. Next slide, please. So with that, I'm going to turn it over to Ruth, who will share with us some ways that our communities can become active in our lifestyle management to prevent the development of cardiovascular disease. Thank you.
Thank you, Dr. Johnson. And my slides will come up. So we're briefly going to discuss healthy lifestyle choices. Okay. Again, my name is Ruth Wilson. I am an oncology nurse. I work in oncology pre-admissions. We admit any patient being admitted for chemotherapy, we process their admissions. And I'm also an active member, next slide, please, an active member of National Black Nurses Association and the Pittsburgh Black Nurses in Action, and I am a certified YMCA fitness instructor. And this picture that just showed my department, we have office space and we have a space to treat patients as well. Next slide, please. Okay, a healthy lifestyle. A healthy lifestyle includes mental health, physical health, exercise, diet, and environment. Next slide. Okay. Well-being. Well-being is defined as how comfortable you feel, how happy you are, and the state of being healthy. Well-being can vary. And typically to gauge your well-being, how do you feel 4 to 5 days out of the week? Are you happy? Are you stressed? Are you distressed? Are you sad? Are you down? If you are feeling happy more days than not, you would tend to report a better well-being. And if you are stressed or distressed more days out of the week, then your well-being is usually reported as lower. Good sleep. Good sleep is important. How many people get 8 hours of sleep? Sleep impacts your health. It impacts your body's ability to regenerate overnight. It helps with your immune system. It helps with you physically. So good sleep, getting those 8 hours of sleep is very important. Reduce stress. We have all had to deal with COVID-19 over the past few years. It has been very stressful. It's been very stressful for those of us in healthcare. It's been very stressful for those in the community. Every single profession has been impacted. How are you dealing with the stress? We have gas prices that are higher. We have this war in Ukraine. What do you do with this stress? Therapy. Therapy helps with mental health. So many people experience depression is very common. A lot of people have experienced trauma. So therapy is very important with dealing with mental health. Some people suggest, just as you see your PCP once a year, it's really important to check in with a therapist. The therapist and yourself, you can come up with a plan to decide how often you need therapy. Therapy is a good thing. Coping strategies. How do you cope with the stress that we've had to deal with? How do you cope with the stress that comes in your life? Everyone has to deal with stress. So it's important to realize and discover what coping strategies work best for you. There are research studies that support those who said that they have a prayer life and they incorporate prayer. They've had lower levels of stress. It's even impacted their heart condition. Deep breathing. I don't know if you've ever seen someone when they were really upset and you felt that they were going to explode, but then you just see them take a deep breath. And you can even do this now where you're sitting. Take a deep breath in through your nose, out through your mouth. That's called a cleansing breath. That helps with stress on the spot. Exercise. Exercise can help with stress. Talking to someone can help with stress. This helps with your mental health. Next slide, please. Physical health. Physical health includes your blood pressure. A normal blood pressure is 120/80. If your blood pressure is higher than that, you need to talk to your doctor about what number it is and what you can do to bring your blood pressure to the normal range. Heart disease. That includes high cholesterol, high lipids. That is checked through your blood work. Blood glucose, your blood sugar. Oftentimes people are pre-diabetic and diabetic and don't have any indications. The three biggest signs of high blood sugar, and by this time your sugar has probably been high for a while, but if you have increased thirst, can you hear me okay? Okay. Increased thirst. If you have to urinate more often, if you're very hungry, those could be three signs that, I need to talk to my doctor and get my blood sugar checked. Physical health includes endurance. Can you walk 10 feet without getting winded? Can you walk up a flight of steps? A lot of times when we think about physical health, we just think about if I'm overweight or if I'm not overweight, but your weight could be within a normal range. But if you have poor endurance, your physical health can use some improvement. Again, you want to check in with your PCP at least once a year. Know your numbers, know your blood sugar numbers, know your blood pressure numbers. If you cannot get in with your PCP as soon as you'd like to, I know everyone's catching up on their care from COVID. Places like Sam's Club and some grocery stores, they have a portable blood pressure monitor. You sit down, you put your arm through the sleeve. Walmart, and you can see a number. Know your numbers. Screenings, it's important to get your screenings done. If you are 50 or above, you should have your colon cancer screening. Screenings really save lives. You want your annual mammogram. This helps with physical health. And then lastly, there's family history. Many people, especially in the African-American community, have family history of heart disease, of high blood sugar, of diabetes. Just because you have a family history of these diseases, it doesn't mean that you have to die from this disease. It just means if you have a family history that you want to be very careful about what you eat. You want to make sure you incorporate exercise. You want to have a nice team effort with your physician so that you don't have to suffer from these diseases. Next slide, please. Exercise. When you hear exercise, do you groan and say, oh, exercise? Or do you think, oh, I get to exercise and move? So according to the American Heart Association, we should have 150 minutes of exercise per week. And that may sound like a lot to a lot of people, but really it's not, and you're able to do it. There are 7 days in a week. Let's take 5 out of 7 days you exercise. 5 days, 150 minutes divided by 5 days, that's a 30-minute walk. That's a 10-minute walk in the morning, 20-minute walk in the evening. You can fit exercise in. An alternative to 150 minutes of moderate exercise, which includes a walk, you can do 75 minutes of vigorous exercise. That could be riding a bicycle, that could be running, that could be spinning. There are it could be swimming, and you can divide it up. And you'll see on the left hand, just more recommendations from the American Heart Association. Please go to their website. They have great ways that you can get moving, great ways that you can be healthy. If you're sitting a lot, you should get up and move. I know at least half of my day, I'm sitting at a desk. Every hour, get up, talk on the phone, walk to the furthest receptacle. You just want to move. If you are watching TV on commercials, get moving. You can walk, you can join a gym. If you're going to lift weights, which they do recommend weight training, it not only helps with diabetes, it helps with your muscle mass, helps you to burn more, but it also helps to prevent osteoporosis. And African Americans can also get osteoporosis. So weight training is very important also. Get an accountability partner or a group, whatever works for you, find what works for you. And whatever doesn't work for you, if you're doing an activity and you're dreading it, that's not the activity for you. There's another way that you can exercise. Exercise makes you feel better. It releases serotonin. It helps with your well-being. The release of serotonin is temporary. So if you exercise one day, that good feeling is not going to last for 3 weeks. You want to exercise more than once every 3 weeks. So you want to keep moving, makes you feel better. For a lot of people, it can make you nicer because you're in a happier mood and people find you more pleasant to be around. So find what works for you. Next slide. Again, be creative, move. Chores counts as activity. Anything that you can think of, stretching, dancing, put music on, whatever you like, do it. Walking at the grocery store. If you go to the mall, walk laps around the mall, but just keep going at a nice pace, feel your heart rate get up. A vigorous activity, it's probably hard to have a long conversation. A moderate to mild activity, you can talk without being out of breath. Next slide, please. Eating healthy, a healthy diet. A lot of insurance companies include a dietitian. It is great if you can meet with a dietitian and come up with a plan that works best for you. You want to eat a colorful plate, fruits and vegetables, limit sugar and fried foods, control portions, allow time to enjoy your meals. So if you're very hungry, you haven't eaten all day, it's more likely that you'll get larger portions. And if you eat really fast and not allow time to enjoy your meal, chances are your brain didn't get the message that you're full. So you want to allow time. You want to plan ahead. Meal prepping is very helpful for a lot of people. And if you go to the American Heart Association website, they even have a meal prep list, and it tells you what items you should get from the grocery store. And that's very helpful. Next slide, please. Emotional eating. How many of us have done emotional eating? If that's you, you can quietly raise your hand. It's something that affects a lot of us. We can emotionally eat when we're stressed, depressed, sad, overwhelmed. When we're happy as a reward, oh, I did really great on that project. I'm going to reward myself with a cupcake. And there's nothing wrong with doing that sometimes, but if it's every day, there are other ways that you can reward yourself. You can reward yourself. There might be an item you want to go shopping for and reward yourself. There may be a new Fitbit you want to reward yourself with. Boredom. If you're staying up late watching television, it's easy to emotionally eat. So it's encouraged to do mindful eating. So you think, why am I eating? Am I hungry? Am I sad? Am I stressed out? And if you identify, I'm eating these sweet and salty foods, which it is very natural to crave sweet and salty foods when you're stressed. They provide comfort. Being mindful is identifying that and coming up with an alternative. So, instead, I'm going to eat this popcorn that I popped myself instead of giving into these unhealthy snacks. Next slide, please. Environment. Sunlight makes everyone happy. I see outside the sun just came out again. Sunlight is very important for a healthy lifestyle. The vitamin D is very important that we get from the sun. In Western Pennsylvania, we get less sunlight, so we have to be more intentional about getting sunlight. People who have low vitamin D levels often report feeling fatigued. So that's something that I noticed that some PCPs do add on the blood work when someone's been complaining of fatigue. So get your vitamin D level checked. The best source is sunlight, but they also have supplements that help. And there are some foods that are rich in vitamin D. Like Dr. Johnson said, our environment, our access to care, clean air, water, what's in your neighborhood? Is there a place that you can walk around? We're talking about taking a walk 5 days a week, but is there a safe place you can walk? Is there a place nearby? Safe workplace. Are you working in an environment where you're harassed? That doesn't help your health. Are there parameters set up to keep you safe from harm? That's very important. And also connections with others. It's very important with being healthy to have those who support you physically and mentally. And even if you're an introvert, it's always nice to have someone that you can talk to, and even if it's a group to belong with. That also, these are all intertwined. So going back to mental health, if you have trouble connecting with others, if you don't have a support system, talk to a therapist. They can help you to find ways to connect with others. It's nice to connect with others who have shared interests, and it's nice to have a diversity in groups of people that you interact with. Okay, next slide. You got this. A lot of times when you hear about being healthy, it really bothers people because they think, oh, you're just going to say I need to lose weight, or you're just going to say I'm doing this bad, or maybe how many of us we've tried to eat healthy, to live healthy. January 1st, everyone has a great plan, and then 60 days later, that plan has fallen through. You got this. You can do it. You can be healthy. It's one step at a time. If you want to have lifestyle changes, the best thing to do is one thing at a time. So let's say if you're eating fried foods every day, smoking cigarettes, eating sweets, instead of saying, I'm going to get rid of everything on day one, pace it out. Day one, I'm not going to drink sodas every day. Week 2, I'm going to smoke less, but you can do this. You got this. Thank you. And then next, our moderator, Lisa, is going to host our question and answer session.
Thank you, Ruth. And both you and Dr. Johnson gave fabulous presentations. So hats off to you, and thank you so much for the information. I feel that I've certainly learned something, and I'm sure our listeners have as well. Again, our chat line is open. So if you have any questions or comments, we encourage you to go ahead and put your question in the chat. I do have a couple that I can start off with our presenters. And I'll start with you, Dr. Johnson. Our first question will be for specialty care. Do you find that the volume of PCP referrals for people of color tend to be less than that of those of Caucasians or those that are non-Black?
Wow, that's a great question. So the way that you framed it is, do I find, and I can tell you my personal experience, and then I can tell you what the literature says. So I tend to see a fair number of Black patients in my clinic, and I think that a lot of those are self-referrals. You know, people may see me in the newspaper or, you know, some type of outlet, and they want to come see me, and so they refer themselves to see me. I think that that proportion is a little bit higher for those self-referrals for my Black patients than it is for my white patients. The self-referral is someone who volunteers themselves, whereas a referral from someone's PCP, where it's been established that they have some cardiac condition that they need to see a cardiologist, that is something that I probably see less of for the Black community. Now, the literature also supports that. We know that people who have cardiac diseases, people who have other diseases that could be treated by a specialist, should be seen by the specialist within a certain period of time. And that tends to happen less frequently for people who are Black, people who are Latinx, as well as people who do not speak English as their primary language.
Great, thank you. Our next question is in the chat, and this one is for you, Ruth. Should we use an air fryer to eat healthy?
That's a great question. I am not a nutritionist, but in my opinion, air fryers are healthier because you're not using that grease and it's not the same system as fried food. So I've read a lot of columns from dietitians who have said that that is a good alternative, and it tastes good too.
I would agree.
Yeah.
Next question in the chat, and this one will be for you, Dr. Johnson. What are some concrete ways that we can advocate for ourselves in a biased or perceived biased healthcare system?
That's a great question. It's a little bit complicated. I think that in general, self-advocacy is important and needed. If you have someone that can help you navigate the healthcare system, that's even better. For example, if my mom goes to the doctor and I can go with her to the appointments, it's a little bit challenging in COVID times. And with my schedule, I may not be available. And the reason why I say it's tricky is because if we blame poor outcomes on people not advocating for themselves, that's like victim blaming. You know, if we say Black people don't have good outcomes because they don't understand when they go to the doctor, they don't know the right questions to ask, that's not the right way to frame it. It really is incumbent upon the physicians, the healthcare system to do better by their patients. But having said that, there are some ways that when you enter that healthcare visit, when you enter that interaction with the physician or the nurse, that you do come prepared. So if you have certain symptoms, write them down. If you have questions, write them down. And don't be afraid to ask them. If you feel that you're being rushed, just say, you know what, I do have these questions that I would really love to have answered. And don't be afraid to do a follow-up visit. You know, sometimes it is hard to get everything answered in one setting. You could always follow up. You can communicate, if you have access to internet, communicate via email with the hospital, with the nurses in the doctor's office. And then also be careful about what you get online. You can Google anything, but you should look for trusted sources. So, you know, Ruth talked about the American Heart Association. I love referring patients to American Heart Association because it's trusted resources there.
Great, thank you. We have more questions coming in through the chat, so thank you all for your participation. This next one, again, I'm going to tap you again, Dr. Johnson, on this one is talking about social determinants of health. You know, how can someone control those independently, and what is genetic, and what is genetic and what can I control in terms of social determinants of health?
Yeah, so so the social determinants are sometimes things that we can control. If we move to a better neighborhood, if we get a better job, if we are getting master's degrees and, you know, different levels of education, those are things that we can control. But then there are other more systemic barriers that are out of our control. And we know that systemic racism are things that we cannot control. And despite having, my colleagues and I did a study that despite having higher levels of education, Black people tend to still have poor health outcomes. And I think that that is stemming from systemic barriers such as racism. So, there's only so much that we can control as individual patients. The second part of the question about genetic things, so hereditary conditions, like as Ruth mentioned, having a history of heart disease, you don't have to then die from that. You can do lifestyle modifications. And really the amount of genetic determinants that you have is probably about half of what determines your health outcomes. Your lifestyle controls that other half. So if you know you have a family history of heart attacks or a family history of high blood pressure, that means you have to work even harder at living a healthy lifestyle, cutting out foods that you know aren't good for you, substituting oils that you're cooking with maybe olive oil or a healthier oil, and really be cognizant and mindful of the things that you put into your body, the things that you do every day so that you can live a healthy lifestyle.
Great. This next one is for you, Ruth. How does one break the cycle of yo-yo dieting and become consistent?
Yeah, discipline one thing at a time, one day at a time. It's nice to have that accountability person. So even if you have a dietitian, that's your accountability person. There are health coaches out there that can help you. I would say get support from someone else and don't try to do it by yourself.
Great. I will add on here having an accountability partner when you're trying to develop a healthy lifestyle is really important, and also helps for having a mental health partner when you feel that you're going down, and someone as a support, to aid and support if whatever your goals are. So I would agree with that one. The next one is for you, Dr. Johnson, is how do we address implicit bias and systemic racism? Just to follow up to the prior question.
Well, as I was mentioning before, I think that it's not really up to Black people to address systemic bias. I think that we should become maybe have better coping strategies of how to live in a racist environment, and how to survive. Speaking personally, I have been at predominantly white institutions for my entire career, albeit it's been a relatively short career, because I'm still, relatively early in my career. But there are techniques that you need to be able to navigate and survive in these environments. They can be hostile, they can really bring you down, and talk about mental health. And so the importance of having that network, like we were talking about, a network of peer mentors, a network of people that you can, have that text chain and just kind of commiserate a little bit with, it helps because it helps you to realize that you're not the only one. And sometimes you may face microaggressions and you can't really put a finger on, was that racist or not? And so being able to talk about those situations candidly with people that you trust is so important. Yeah, and I mean, I know that you tapped me to answer this question, but I think we could probably have an open discussion about this because, and I know Lisa and we talk about this kind of stuff all the time.
Well, yeah, and I will tap into that. And I do believe that, a lot of times when you're dealing with implicit bias and systemic racism, now it's probably more on the forefront and more people are talking about it. Although people of color have been dealing with it for a long time. And we've learned how to cope and how to manage and develop strategies that allows us to be able to navigate within different types of groups, meaning those that you're in your tight-knit trusted group, and then those that we will call maybe your informal or your formal work groups, those that you don't necessarily have relations with. But I do think that it's critically important. One thing that we didn't talk about is when we're looking at young people that are transitioning from college to work, it's really important that we as professionals that will be working, Black professionals or those that are competent in this space, to be able to help them to navigate through and becoming aware and how to cope as Amber had or Dr. Johnson had mentioned, in terms of having coping strategies when you're getting in a workplace, because it could be very toxic to those that are unaware and detrimental to their career as they're moving forward without being volatile, where they may have been able to do that without consequence in college versus when they're in the professional workspace. So we could go on. Amber and I have conversations about this all the time. But again, it also proves her point of being in a safe space and being able to have those discussions where it goes and taps into what Ruth talked about. Sometimes you need that for your mental health. You need an accountability partner to be able to say, was that okay? Was it not okay? But you had a place to be able to openly discuss and figure out how you're going to navigate the next time or hold individuals accountable to that in a professional manner. Our next question is for you, Ruth. I hate all exercise. How do I get started?
So whoever asked that question, you are not alone. A lot of people hate all exercise. I remember a time I hated all exercise. For many years I did. I was overweight for many years when I was young. And it's still just, sometimes you just have to do what you don't feel like doing. So walking tends to be our go-to. If you say, I'm gonna go on a walk, and maybe your first walk, you hated it because you hadn't been walking. And if you haven't been walking, your legs kind of tingle, you're achy, go for a walk again. 2 days later, go for a walk again. 2 days after that, go for a third walk. By that third walk, once you're 10 minutes into your walk, you will be able to enjoy the endorphins that you got from your walk. So sometimes it's just a discipline. I don't like this at all. I'm going to keep at it because I have to be healthy. And then you may find something. And then there are group activities, like Lisa teaches a Zumba class. The energy in a Zumba class is wonderful. Everyone's encouraging, you're having a good time. So you're getting your heart rate up, you're burning calories, you're working a sweat, but you're having a good time moving around. Even if you can't dance, you don't have to be able to dance. So it's just being willing to try different things until you find something that you do like. And if you still don't like anything, just walk.
And, the next question actually will tap on to what you just stated, Ruth, was, if I haven't worked out in a while, what's the best way to get started? What are, maybe telling them, what are some incremental steps for people to do so that they have success and want to continue to keep going?
Right. Start slow. Start with 10 minutes. 10 minutes still counts. So if you haven't been active, say, I'm going to do a 10-minute walk on a steady path. Just start small. And also with just the whole accountability, find someone else that you can take a walk with. You can talk about work or life. You can debrief, and you're killing 2 birds with 1 stone.
And can you make any suggestions for virtual options? This is also another question that we have on here in terms of having access to moving and exercising.
That's great. So with COVID, there have been even more online places that you can do virtual exercise. You can go on YouTube and you can search any exercise. They even have chair exercises you can do from your living room. They have HIIT exercises, which is high intensity interval training, which works really well. Peloton also has there's a cost associated, but it's not just the bike. There's a treadmill, and they have different exercises that you can do, stretching, things you can do right in your living room. So there are a lot of virtual things, but you can go directly to YouTube.
Great. So I see someone wanted some information about the Zumba class. We will send it to and give it to our partners at Gateway Health at the end of this so that they can share it with all. But I want to give Dr. Johnson a couple questions here. When we talk about,
Lisa, can I jump in real quick just about the exercise?
Yeah.
And I do look forward to the questions that you have, but I was like so anxious to like share this piece of information, these thoughts about exercise too. And what I'm really interested in knowing and understanding is, why is it that us in the Black community, especially Black women, are less likely to exercise? And so I think, going back to that question about I hate all exercise, I would want to know why. And, maybe that's the researcher in me, like, why do you hate all exercise? What is it about exercise that you don't like? And can you address that barrier? You know, if it's because you don't want to get sweaty, if it's because you just got your hair done, if it's because you don't have a safe space, like those are things that you need to address and overcome that barrier. And that will allow the exercise, the building that habit of exercising to become more attainable.
And you know what, Amber, and to your point, I'm going to agree with you because, you know, looking at the root cause of why don't you want to do it is really important. When we are probably teaching our classes, and I don't know, Ruth, you may have experienced the same. You may have some folks that come twice and that's it. And you know, and you're out there and you really provide this service because the goal is to be able to provide access to exercise to people of color, and they're the ones that never show up on a consistent basis. And so why is it we're doing the outreach but you don't seem to be reaching? And so I do think that Dr. Johnson raises a very valid point in really trying to figure out why don't we? Where's the communal aspect of this? Or can we develop one that will make exercising more attractive, or maybe it just doesn't need to feel like exercise. Maybe, I don't know, it's a bad word, but what do we do to get there? So I think that is an excellent question. And I think that's something that really all of us here, and probably many of you out there, have those same thoughts. So help us out, you know?
One thing with the women in our community with exercise, I am a member of Black Girls Run, and they have stations everywhere. There's a Pittsburgh one that I belong to, but it's very nice. They are friendly and they map out a route that's safe. It's in a safe place. And it's for people who are beginners. So you don't even have to be a runner. You can just be a walk, and you're meeting with other people, you're talking, you're meeting people from different backgrounds. So there are a lot of solutions for those. If that's your barrier, you don't want to mess up your hair. I know I didn't do my run this morning because of my hair. So I had to find another alternative at home. But there are groups that can help with whatever your barrier is. There are groups that can help you overcome those barriers.
Well, Dr. Johnson used to do Black Girls Run too. So, you know,
really?
back then you do Black Girls Run.
I think I may have signed up, but never. So I'm like prime example.
A great group.
So I think we are really at our time, and this has been a wonderful experience talking to you both. Your presentations were great, and you know, again, we want to thank Dr. Isaac and the Gateway Medical Society and Pittsburgh Black Nurses in Action for inviting us to this. Joanne Boyd will be taking us home and closing out the session, so I will turn it over to her for her closing comments. Thanks. You're on mute.
Sorry about that. Thank you, Lisa, and thank you so much to Ruth and Dr. Johnson. Some wonderful, wonderful presentations. A lot of information to take away for us all. It is certainly a great collaboration with Gateway Medical Society and Pittsburgh Black Nurses in Action to bring this webinar to you. And we are very happy that you took the time to spend from your afternoon in the audience to share in that. There's so many takeaway points. You know, I was thinking, wow, you know, when we look at social determinants of health and what we can do as a community, how to energize ourselves and make a difference and be that advocate for ourselves, for our heart health and all of our health. So we got a lot of good resources that were shared and ideas that were shared. The whole notion of healthy lifestyle and living, what we can do and making those steps, even those small steps to change our lifestyle pattern. So I guess when I leave here to go do my dishes, I'll probably do a dance in there so that will show, you know, that I've taken something away from this, presentation, which was a lot to take away. So to our audience, for 40 of you that have attended today, we are going to randomly select 40 of those attendees and send a small gift to you. It will be sent to the address that you provided when you registered for this webinar. So we will do that randomly, and that will come out to 40 of you who are in attendance. But again, I thank you for this time in the afternoon. We have, just about 5 minutes left. If there was anything else that our speakers wanted to say, certainly in that 5 minutes, it's great to do. Other than that, we will give you that 5 minutes back for your day.
Thank you for having us. We appreciate it.
Thank you.
It was a great session.
Great session, everybody.